a stroke is happening, we must know if it's a stroke or not, right? So I'm sure in your case as well, you must have had like initial doubts what's exactly happening with me. But to know if it's a stroke, there's an acronym that the medical fraternity often uses, and which should be our takeaway message from this Instagram live. It's called BEFAST. Okay, that's be fast. So I think that's the message that the World Stroke Organization is trying to put forward for every stroke patient or the survivors. I'm not sure if you are aware of Be Fast. Would you like me to elaborate on Be Fast, or I'd like to know your version?
Yeah, might as well. Yeah, I think a lot of us are, but it doesn't hurt to hear it again. Yeah.
Yeah. Okay. So now Be Fast is basically B is for balance. Okay. So if someone near you is actually having difficulty in trying in walking or maintaining their posture or balance while standing, that's a balance issue. E is for eyes. Like if you have any eye symptoms, like if you are seeing two things while you should be seeing just one, which is called diplopia, this blurring of the vision, half of your eye field is not clearly visible to you. These could be signs of stroke. So eye signs. F is for face. Like it's very evident when you have a facial drooping of one side. You may have asymmetry of the face, which is a sign of stroke. A is for the arm weakness or even the limb weakness. Legs are also part of it, in which you can have difficulty in doing your routine things with either one or the other limb. Then S is the speech. Like when you're trying to say certain things or speak, the speech may not be very clear. There are certain mispronunciations or this confused speech. There is a staccato speech, particularly in cerebellar stroke. There's a speech which becomes a bit robotic or monotonous at times, or dysarthric speech could be there. So if you have any of the BEFAS, then T is very essential. T is basically for the time. Now, when we think of BEFAS, T becomes very emergent situation. You need to call for the help right away. You need to dial 911. The moment you have any of the symptoms that I just mentioned, that means you might be having a stroke. And in that case, it's very prudent that you reach to the hospital as soon as possible. That's why whenever you think of stroke, you have anyone around you who's probably having a stroke, be fast. And that's the whole acronym that one should always remember while dealing with stroke.